And it's good to see you all. As you know, we at the Children's Hospital of Philadelphia, I'm a pediatric cardiologist at CHOP, have worked with the school district for at least the past 2 decades, if not more. And after the law was passed that CPR and AED education was a requirement for high school students before they graduate, we actually came to your PD at Lincoln High School last year and participated in multiple sessions throughout the day. But I don't have to tell you all that COVID has changed everything for all of us. So we're doing a lot of medical practice and a lot of our advocacy and education work from a virtual platform. And so we worked with Ms. Judith Peters and Nancy Neowith to develop a virtual CPR and AED curriculum that we hope with a lesson plan, and we hope that you'll be able to use that to teach your students CPR and AED use this year. So we put together a video to kind of go through how to do that. There are a number of handout sheets that are available through the lesson plan that the district has, things like how to make your own mannequin and how to make your own AED to practice. So hopefully you'll be able to use this platform and this lesson plan. And we really, since we're new at doing this kind of virtual education as well, hope that you will give us your feedback so that we can make this an interactive kind of living type of lesson plan and improve it as the time goes by. Because even without COVID, this will allow us all to reach and educate more people. So what will happen is you'll see a video. I'm going to speak about some basics about CPR, AED, sudden cardiac death. Richard Keller, who is my Youth Heart Watch coordinator, Richard can wave, is going to be on the video, and Lindsay Flanagan, who is my other Youth Heart Watch coordinator, is also going to be on the video. So there is a chat room, as you know, and you can ask your questions, and by the end of the session, we hope that we'll be able to, again, connect and answer any questions that you might have. Please do mute all your microphones, and I hope that this will be somewhat helpful to you in the school year to come. And I certainly wish you the best in your online education endeavors as we all go through this together.
Can everybody see my screen? Just give me a thumbs up. Perfect.
Yeah, Amani, it looks like you may not have any volume. Are you muted?
Oh, there we go. I'm sorry.
It's okay.
Hi, I'm Dr. Victoria Vetter. I'm a pediatric cardiologist or children's heart doctor at the Children's Hospital of Philadelphia. I'm also medical director of Youth Heart Watch, an affiliate of Project Adam. Our mission is to prevent sudden cardiac death in the community. We've been working with the leadership of the School District of Philadelphia for the past 20 years and would like to present a lesson plan that we have worked on jointly with your leadership. Our video today will provide introductory information about sudden cardiac death, CPR, cardiopulmonary resuscitation, and AED's automated external defibrillator use. We will discuss teaching points, incorporate the American Heart Association CPR in Schools video that you can show or stream to your students, and provide additional guidance, and after the presentation, answer your questions in the chat section. Sudden cardiac arrest, or SCA, occurs when the heart suddenly and unexpectedly stops beating, usually due to an electrical abnormality in the heart, and no blood with oxygen is pumped around to the body. Without intervention such as CPR, cardiopulmonary resuscitation, where a bystander assumes the pumping function of the heart by pushing hard and fast in the center of the chest 100 to 120 times per minute, or the use of an AED, an automated external defibrillator, a computerized device that can recognize an abnormal rhythm, determine if an abnormal rhythm needs to be restored to normal by providing a shock, sudden cardiac death will occur. The most common causes of sudden cardiac arrest in adults includes an association with heart failure from a weak heart muscle or from hypertension, or after or during a heart attack, or from a primary electrical abnormality. The most common causes in young people include primary electrical conditions, frequently inherited, such as long QT syndrome, ventricular tachycardia, or myocarditis, a viral infection in the heart, or WPW. Inherited cardiomyopathy, such as hypertrophic cardiomyopathy and dilated cardiomyopathy, are anomalies in the origin of the coronary artery, not from coronary artery blockage. Drugs and stimulants can also cause a sudden cardiac arrest. Successful outcomes depend upon the quick and effective performance of CPR by lay rescuers or bystanders and the use of an AED by the bystander, EMS, or healthcare provider. Bystander CPR rates are low in most communities, averaging 15 to 30% prior to EMS arrival, and current survival of out-of-hospital cardiac arrest is only around 10% in both children and adults. CPR, especially performed immediately, can double or triple a person's chance of survival, as can AED use. In recent years, additional attention has been focused on AED placement and CPR AED education in schools to improve survival of children and adults in the school. The presence of an AED in school and the performance of CPR can increase survival up to 88% from 10% in children and adults in the school. Periods of activity such as PE class or gym or athletic events can increase the chance of having a sudden cardiac arrest, but this can occur at any time. We know that sudden cardiac arrest does occur in schools, and effective responses such as at Benjamin Franklin High School a few years ago resulted in saving a student's life. Regarding training in CPR and AED use in schools, important areas to emphasize while teaching include recognizing sudden cardiac arrest, calling for help and calling 911, getting an AED, and performing effective CPR. Several studies have shown that CPR and AED use can be taught to children and adolescents by school teachers as effectively as by healthcare providers. The American Heart Association specifically recommends that AED training and skills practice should be included in schools' CPR training, as students with hands-on training are more willing to perform CPR and know how to perform it more effectively. By educating students, more lifesavers will be present in our communities to save lives. On June 12, 2019, Pennsylvania became the 39th state to pass legislation, Act 7 of 2019, that includes CPR and AED education for high school students in their health and PE classes. The CPR AED education curriculum that you are going to teach will ensure that our Philadelphia high school students have the knowledge and skills needed to save a life that could be yours, their friends, or their family members. This video that you are about to see will take you through the CPR and AED in schools lesson plan that you can adjust to fit your own teaching style. We're using the framework of the American Heart Association CPR in Schools video that you can show or stream to your students. The students will learn the basics of sudden cardiac arrest, understand CPR, and learn the steps, know the differences in a sudden cardiac arrest and a heart attack, understand AED use, and know the steps to use an AED, and practice the psychomotor skills of CPR and AED use. Putting this all together, including practice for a large portion of the class, will help them to become lifesavers of tomorrow. I would now like to introduce our Youth Heart Watch and CHOP coordinators, Richard Keller and Lindsay Flanagan. They will demonstrate the various modules from the lesson plan, especially CPR and AED. Thank you very much for your attention.
Thank you, Dr. Vetter. I'm Lindsay Flanagan, the Youth Heart Watch Research Coordinator, here with Rich Keller, the Youth Heart Watch Program Coordinator. Today you will learn or receive a refresher on how to perform CPR and use an AED. We're going to be using the American Heart Association's CPR in Schools training video to show you CPR and AED skills. We will skip some videos or shorten others to make sure we get through our allotted time today. But we will be teaching you the most important skills that you will need to save a life. For those teachers who will be teaching CPR in the classroom, you will have all the videos available and should play the modules listed on the provided lesson plan in their entirety. We're going to start today's video at Module 2 and discuss the differences between heart attacks and cardiac arrest and the steps leading up to CPR.
Picture yourself giving someone CPR. The person is lying on the ground in front of you, and you're pushing hard and fast in the center of this person's chest. What is CPR doing to the body to help keep the person alive? Try to visualize how CPR is helping save this person's life. When you give compressions during CPR, you're acting like the heart, helping to push oxygen-rich blood to the brain and the rest of the body. This can help someone survive when his or her heart stops beating. You've probably heard the terms heart attack and cardiac arrest before. You might think a heart attack and cardiac arrest are the same thing, but they are not. There are some very important differences. The major difference between the two is that during a heart attack, the heart is still beating and pumping blood, and the person is still alive. During cardiac arrest, the heart has stopped beating and the person doesn't respond and isn't breathing normally. A heart attack occurs when a clot forms in a blood vessel carrying oxygen-rich blood to the heart muscle. When the heart doesn't get enough oxygen from the blood, the muscle starts to die. A person having a heart attack needs immediate medical treatment. If the blocked vessel isn't reopened quickly, the muscle normally nourished by that vessel begins to die. Typically, during a heart attack, the heart continues to pump blood so the person doesn't need CPR. The longer the person with a heart attack goes without treatment, the greater the possible damage to the heart muscle. Occasionally, the damaged heart muscle triggers an abnormal rhythm that can lead to cardiac arrest. Anytime the heart stops beating, it's called cardiac arrest. Heart attacks aren't the only thing that might cause cardiac arrest. Cardiac arrest can also be caused by problems such as severe injuries, drowning, and drug overdose. When the heart stops beating for any reason, a person needs CPR immediately. You might think cardiac arrest happens only to older adults. But the truth is, cardiac arrest can happen to anyone. It can happen to a high school athlete, a family member of any age, or even a child or infant. It's really scary to see someone in cardiac arrest. But if you phone 911 and start CPR immediately, you can help save that person's life. Don't be afraid of doing something wrong. This video will help you learn what to do so that you can give CPR and help save a life. Imagine you're at a school athletic event when you witness a man suddenly collapse in the bleachers next to you. We're going to teach you exactly what to do. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the person on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the person doesn't respond, you need to get some help. Shout to see if anyone is nearby. Say something like, "Help, somebody help me." If someone arrives, tell the person to phone 911 now and get an AED if it's nearby. If no one comes to help you, you'll have to phone 911 yourself. If you have a mobile phone with you, phone 911. Use the speaker mode while you talk to the dispatcher so that you can leave both hands free to start CPR immediately. If you don't have a mobile phone, you'll have to leave the person to phone 911 and get an AED yourself. The dispatcher will ask some important questions, like what's your exact location, so that help can be sent quickly and to the right place. If you're calling from a mobile phone, be very specific about your location. Don't hang up the phone unless the dispatcher tells you to. The dispatcher should help you remember the steps of CPR and how to use an AED if one is available. Once 911 has been called, you'll need to check to see if the person is breathing normally. Check for breathing for at least 5, but no more than 10 seconds. Look at the chest to see if it's rising as he breathes. If you see a person gasping, it's important to know that this isn't regular or normal breathing. A person who gasps usually appears to be drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. If a person who doesn't respond isn't breathing normally or is only gasping, it's a sign of cardiac arrest and the person needs CPR.
During a heart attack, the heart is still beating and the victim is responsive. This occurs due to a blockage in blood vessels. Cardiac arrest is when the heart has stopped beating and the victim is unresponsive. This occurs because of an electrical signal issue causing an abnormal rhythm. Heart attacks can cause cardiac arrest, along with many other things. Victims of sudden cardiac arrest often gasp for breath, and this may occur early in cardiac arrest and are not effective breaths. Ineffective respiration will not maintain oxygenation or ventilation. Victims may also exhibit seizure or convulsion-like shaking activity. The video also discussed the steps leading up to CPR. They are: make sure the scene is safe, make sure the victim is really unresponsive by tapping or shouting, yell for help, call 911 whether it is you or a bystander, and get an AED if available, and check for breathing. Before we move on to showing the steps of CPR, I want to discuss the chain of survival. The chain of survival refers to a series of events that may occur in rapid succession to maximize the chances of survival. The first step is recognize a sudden cardiac arrest. Second step, call 911. Then start CPR, use an AED if available. Then the EMS responds, and then the victim is taken to a healthcare setting. Bystanders can help save lives by addressing the first 4 links. Now we're going to move on to Module 3. Included in this module are practice steps leading up to CPR, high-quality compressions, and then practice of these compressions.
Thank you, Lindsay. My name is Richard Keller, and I am the project coordinator for the Youth Heart Watch. Before we begin our talk on compressions, I just want to quickly recap the steps leading up to CPR that Lindsay just went over. So the first thing we're going to make sure is that the scene is safe. We don't want to put any of ourselves or anybody around us in harm. We're going to check responsiveness, and that's simply done by taking your hands and shaking the shoulders of the person that you're looking at, making sure that they're awake. Hey, are you awake? Something simple as that. We're going to send someone for help. We're going to ask them to call 911, and then we're going to ask a separate person, if possible, to grab the AED for us. We're now going to assess to see if our victim is breathing normally. So victims in cardiac arrest often gasp for breath. They may occur early in the arrest, but it's important to know that these are not effective breathings. So if you see somebody who is gasping for breathing or not breathing adequately, the next step is going to begin CPR. So now we're going to watch the video on compressions, and then we'll see you in just a few minutes.
We've just demonstrated the steps leading up to CPR. Now we want you to practice those steps. Use your mannequin to practice along with the video while thinking about how you would use these steps in real life. You have just found Minnie Ann lying on the ground. First, make sure the scene is safe. Next, tap and shout. Hey, are you okay? Are you okay? Shout for help and practice sending someone to phone 911 and get an AED. Help, somebody help me. You, phone 911 now and get an AED if it's close. You're not going to actually practice phoning 911 yourself. Check for normal breathing. Check for breathing for at least 5, but no more than 10 seconds. Great job. Now you know how to do all of the steps leading up to CPR. In your lifetime, you may have to perform compressions on a real person by acting like the heart and helping to push oxygen-rich blood to the brain and the rest of the body. Your quick and confident action can help someone survive when his or her heart stops beating. We're going to teach you how to give high-quality compressions. Watch first, then you'll get a chance to practice. Before giving compressions, make sure the person is lying on a firm, flat surface like the floor. To give compressions, kneel beside the person's chest. Move the person's shirt out of the way so that you can see where to put your hands. Put the heel of one hand in the center of the chest, on top of the breastbone, and put your other hand on top of the first. Keep your hands in the center of the chest and push hard, straight down. Make sure to push the chest down at least 2 inches. Push fast at a rate of 100 to 120 compressions per minute. Let the chest come back up completely after every compression. If you bend at the waist and keep your arms straight, you can use the weight of your upper body to compress deeply. Keep giving compressions until the AED arrives, medical help takes over, you physically can't continue, or the person starts to respond. It's time for you to practice compressions. Although we're just practicing today, you may need to use these skills in the future to save the life of a family member, a friend, or even a stranger. Put Minnie Ann on the floor and kneel beside her. Put one hand on the center of Minnie Ann's chest, and then put your other hand on top of the first. Keep your hands in the center of the chest and push straight down, hard enough to make Minnie Ann click. Now, listen to this beat. The beat is telling you how fast to push. Compress to the beat. If you're pushing hard enough, you'll hear Minnie Ann click. Keep compressing to make sure that you know how hard you need to push. If you can't make Minnie Ann click, that's okay. Just push as hard as you can.
All right, so before we get into the actual compressions, I just want to stress a point that you can talk to the students with and asking them, what are we doing when we are actually compressing? So we're acting like the heart. We're pushing oxygen-rich blood to the body, to the brain, and trying to perfuse. So that's important to stress to them as to what we're actually doing when we do compressions. So I'm going to show you now. I'm going to just adjust myself here. I went ahead and made my own mannequin, so I can show you that. It's just simply made with some stuff that we used around the house. I have a couple hair ties, a t-shirt. You'll notice on the inside I have parts of bags, and then just a simple soda bottle. But this is a simple and nice and effective way that students can practice CPR while at home. So as you can see, my CPR mannequin is right here. So we're going to talk about the important steps of high quality CPR. So the first thing that we want to do is to make sure that whoever is receiving CPR is lying on a hard, flat surface, much like the floor. We don't want to do CPR if somebody's lying on a bed because we're looking for a depth when we do our compressions, and being on the bed will add a squishiness to it. So always want to do CPR on a hard surface such as the floor. Ultimately, you'd like to kneel down next to the person. Notice that you want to be right in their chest area. So if I were kneeling on the ground, this is right where I want to be, equal with the patient's chest. We're going to take one hand, and we're going to take that heel of your hand and stress that that's going to go right into the center of that person's chest, on the tip of their breastbone. You're going to take your other hand, just like this. You're going to place it directly over your other hand, and you can interlock your fingers nice and tight, but you want to keep that heel pressed down right in the center of the chest, again, on the tip of the breastbone. Now, the act of doing compressions, you want to really stress to the students that they have to keep their arms nice and straight. Notice how my arms, my elbows are in, they're not bent, right? Doing CPR is very tiring. So if you're doing CPR, you want to make it as best that you can do as possible. Keeping those arms nice and straight. We're going to bend at the hips, and you're going to use your upper body strength to help compress. So again, nice straight arms, use that upper body weight, and then compress straight down. Another important part as we're compressing, notice I have those nice straight arms. As you push down, you want to make sure that that chest comes fully up, right? I explained why we do CPR and the fact that we push oxygenated blood through the body, we help perfuse. So stress to the students, when you're actually pressing down on the chest, you're forcing the heart to squeeze. So we're pushing that blood out. And when we recoil and let our hands come up, it's giving that heart a chance to refill. So if we're not coming all the way up, not letting that chest fully recoil back to that upright position, you're not fully perfusing properly at that point. We're looking for a depth of at least 2 inches when we do our compressions. And that's basically what we have to do there with compressions. So the mantra, push hard and fast, you really want to send that home with them. They can remember pushing hard and fast in the center of the chest. That's what compressions are about. So again, we're going to continue CPR until a few things happen, right? We're going to do CPR up until the point that the AED returns. We're going to do CPR up until the point that EMS arrives on scene and takes over, or if you are physically exhausted and can no longer do compressions. We're now going to move on to module 4, and that's going to start talking about our AED. So an AED, right, what is it? So an AED is an automated external defibrillator, which is a portable electronic device that automatically diagnoses potentially life-threatening abnormal heart rhythms and is then able to treat them through a defibrillation or a shock to their heart. We're going to watch a couple of videos real quick, just explaining over the AED, and then we're going to come back and discuss.
Giving CPR right away increases the chance that a person will survive a cardiac arrest. You've learned that it's important to get an AED if one is nearby. Now, let's discuss why. An automated external defibrillator, or AED, can be used to treat cardiac arrest by delivering an electrical shock. An AED reads or analyzes the heart rhythm and then tells you if a shock is needed. Many schools, companies, and public places now have AEDs you can use to treat cardiac arrest. If one is available, have someone phone 911 and bring you the AED. AEDs are often mounted on walls and have visible signs posted to help you locate them. We're going to teach you how easy it is to use one. Using an AED is safe. It can't shock someone unless he or she really does need it. You only need to remember to turn it on and follow the prompts. Once you turn it on, the AED will tell you everything you need to do. Some AEDs will turn on automatically when you lift the lid. Others will require you to push the on button. After that, just follow the prompts you see and hear. Attach pads to victim's bare chest. Some AEDs have both adult and child pads. For children 8 years of age or older, use the adult pads. Plug in pads connector. Analyzing heart rhythm. Pause to let the AED analyze. Loudly state clear to make sure no one is touching the person. Shock needed. Loudly state clear to make sure no one is touching the person. Then, press the button to deliver a shock. Shock delivered. If an AED is available, use it. It's safe and easy, and it can increase the chance of survival for a person who is in cardiac arrest. If you send someone to get an AED, ask the person to use it immediately while you continue giving compressions. Tell the person to turn it on and follow the prompts.
So before we get into discussing what we just talked about in the video, I want to show you a few things that may help you if you have to do this virtually. So not everybody's going to have an AED at home, we know that. So you will have some papers that you can give your students. This is simply a printout of what an AED looks like. Here is some pads here as well. If somebody does not have a printer, they are able to become an artist and simply just have a sheet of paper and they can draw it. It's just something simple as that. I am by no means an artist, but simple drawing will work here. I have my adult pads, and you see I have some child or infant pads here. I'm going to put the AED together with a couple pieces of string. That way they can replicate what it looks like. So before we get into going through the AED steps, I just want to discuss real quick this CPR Ready kit that you may find attached to your AED. So in here, what you may find is there's a pocket mask in here if you are delivering breaths. There is a razor in here. So where the razor is going to be used if we need to shave a chest. If there's a lot of hair on there, sometimes that may interfere with the pad and not allow it to contact properly. So it's just a simple razor here. You just want to do a couple quick passes where those pad placements are going to be. There's a pair of scissors in here. So these are important because once that AED arrives, you're going to want to stop CPR and cut that shirt off. So we have to cut the shirt off because we need direct pad to skin contact. Also in here, there's going to be a couple paper towels. There is a set of gloves in here as well. And then this looks like a 4x4. Now that we've discussed our CPR ready kit, we have the AED. So the first thing you want to do with the AED is to turn the unit on. Some AEDs may have an on button. Others may open simply by lifting the lid. You want to be familiar with the AED that you have at your school. We're going to turn the AED on again, and then the next step is as simple as following the instructions. Every AED is going to walk you through a step-by-step process of what you need to do. We're going to take those scissors, like we said, we're going to open up that person's shirt. We're going to wipe his or her chest dry if they happen to be wet, if there's sweat, if there's some water on them. If the person is wearing any medication patches, with a gloved hand, if you can, you want to remove that patch, wipe the area where that patch was prior to putting that pad on. We're going to then attach the pads. Some units may have the pads plugged into them, similar to mine does. Some AEDs may have you have to plug in a connector. Again, it is super important that you are familiar with the AED that you have at your school. As far as pads, you may find that there's an adult set of pads and that there may be a child set of pads inside your AED. The child pads are designed for any child that's less than 8 years of age. You're going to follow the picture on the pad for the pad placement. You'll notice that on these pediatric child infant pads, they have one pad in the center of the chest, and they have the second pad directly in the center of the back. Okay? The adult pads can be used on anybody that's 8 years of older. Again, you're going to follow the pad placements. Now you notice that this pad has the placement above the right side of the chest, but below the collarbone and above the nipple line. And then the second pad is going to come down here. I'll stand up. I'm going to go on the side of the chest, again, below that nipple line, right in the center here. So what happens if we open up our AED and there's only adult pads in there, right? The adult pads can be used on the adult victim, the child victim, and the infant victim, okay? These are big pads, so if you have to use the adult pads on, say, a small child, and they look like they're going to touch when you put them into that regular placement of up here and on the side, then you're going to take those pads, you're going to simply flip them like you would for the child and the infant placement, placing one pad in the center of the chest, placing the other pad on the back, okay? So now that the pads are on, the AED probably will tell you to stand clear. So what it's going to do now is it's going to analyze. Most AEDs will analyze automatically for you, but again, in knowing the unit that you have, if you're required to push the analyze button, at this point it will prompt you to do so. Okay? The AED is going to advise everybody to stand clear as it's analyzing that heart rhythm. Make sure it's super important that nobody touches that patient at this time so that the AED doesn't read something that it's not supposed to. If the AED recommends that you deliver a shock to that person, again, making sure that no one, including yourself, is touching that patient, you want to simply state something loudly as clear or stand clear. Take your hands, maybe scan them across that person's chest just to make sure that nobody again is touching them. If you are clear, after everybody else is clear, the AED may advise you to hit that shock button. It's a good thing to kind of maybe get a countdown. Hey, I'm going to push this button, 3, 2, 1, shock delivered. As soon as that shock is delivered to that patient, the AED will then prompt you to start CPR again. The other option that you may hear is a no shock advised. And if you do hear that, that simply means that that person is not in a shockable rhythm and that CPR is required. It's simply going to tell you that you're going to start CPR at that point, okay? We're going to do all of this again until EMS arrives, physically exhausted, or the patient begins to show signs that they are waking up. I'm going to leave you with one question, and that is simply, do you know where your AED is in your school?
Here's your chance to practice using the AED simulators. Push the on button. Apply pads to victim's bare chest. Follow the diagrams on the pads to apply them to your mannequin's chest. Plug in pads connector. Analyzing heart rhythm. Pause to let the AED analyze. Loudly state clear to make sure no one is touching the person. Shock needed. Loudly state clear to make sure no one is touching the person. Then, press the button to deliver a shock. Shock delivered. Believe it or not, using a real AED is just as easy as using this one. All you have to do is turn it on and follow the prompts. In this course, we learn about using an AED on an adult or child. When using an AED on a child, use the child pads if they're provided, or the child key or switch if the AED has one. If there are no child options, use the adult pads.
The video states using an AED is as easy as it sounds. Turn the unit on and listen to the prompts. It will tell you to apply pads, stand clear, push the shock button if needed, and to continue CPR. Note that adult pads can be used on children if pediatric pads are not available. You now know how to call 911, perform hands-only CPR, and use an AED. Now practice them often to stay sharp and share these skills with your family and friends. Next, Rich is going to discuss how to help someone who is choking. This overview can be found on the optional lesson plan for those who will be teaching this to the students this year.
So a foreign body airway or something stuck in the airway. This could be a partial foreign body airway obstruction, which basically means that there's something in there, but it's still allowing air movement through the airway. The victim will be responsive and will often cough forcefully. Usually they can speak and their breath sounds may be noisy. These victims typically require no immediate action from you, but be prepared to act, because if the obstruction becomes severe or complete, they're going to need to have abdominal thrusts done. Victims with severe or complete foreign body airway obstructions will initially be responsive, but will not be able to move enough air to cough forcefully or speak. They might make high-pitched noises when they try to inhale. If severe or complete foreign body airway is present, abdominal thrusts are going to be given to relieve the obstruction. So when you come up on somebody and they're going to give that universal choking sign, right? We all know what that is. It's usually their hands crossed across their throat and they're choking. You're going to run up to them. You're going to ask them, "Are you choking?" Typically, they will nod. They won't be able to speak or make any noises with that severe or complete foreign body airway, but we're going to let them know that we're going to help them. At this point, I'm going to use my CPR mannequin that we talked about. We're going to come around that person. You're going to wrap their arms around them, right around their stomach. We're going to look for their belly button. That's kind of the landmark that I look for. I'm going to take my index finger. I'm going to stick it into their belly button. I'm going to bring my thumb up. So your thumb's going to be below that breastbone, and your other finger will be just above the belly button. We're going to make a fist. We're going to stick that directly into the center of that big, nice spot we just made. Then you're going to cover up just like this. All right? We're going to go up and in a J motion, hopefully pushing that object out. We're going to continue to do that until we see the object come out or that patient goes unconscious. And at that point, you would lower them to the ground and begin CPR. If the person is a pregnant female or kind of larger, you're not able to get your arms around them into their stomach, you're going to come up right onto the spot of our CPR, and you're going to push directly down just like you would abdominal thrust. All right, perfect. Thank you.
Okay, I don't think that we had any questions in our box, but there were a couple more points I wanted to make. So can you guys see this? It looks like it's upside down, but this is the CPR in Schools video. Can everybody hear me? Yes, thank you. And on the back of it, it tells you, and this will be in the lesson plan, but it tells you that if you go to ebooks.heart.org and the access code, all in capitals, is CPR in schools, all run together, then you will be able to stream this to your students. And the American Heart Association has assured me that because you all have their CPR in schools kits, that you'll be allowed to stream parts of or this whole video when you want to. So when you're sent the lesson plan, if you already haven't been, then that will have that information on the back of it, just so you know where to get it. Any questions about that? All right, there were a couple other points I wanted to make, and then I want to ask Rich to get Bill so he can kind of go through a little more carefully exactly how he built his do-it-yourself mannequin. So one point about the reason we put victims on the floor is that you want to compress the heart between a hard surface and your hand, so that if you're pushing on the bed, it's just, you know, going down with the bed. So in order to press that blood out of the heart, you have to have that person on a hard surface. And that's the reason you need to pull them off the bed or off of the couch or wherever they happen to fall down, and get them flat so that you're then compressing the heart. The other point I wanted to make is that when Rich was referring to the tip of the breastbone, that's true, but you want to be on the hard part of the breastbone. There's a little tiny bone that looks kind of like a squiggly worm type thing at the end of the breastbone. You can feel it on yourself if you feel. You want to be in the center of the hard part of the breastbone, so that you actually, because that's where the heart is, so that you are actually catching the heart in between the back surface, the flat surface, and the hard part of your heel. So just make sure you're on the center of the breastbone and not too far down toward the abdomen. And then the other point is that many of the AEDs, the newer AEDs that people will use now, actually you don't have to push that shock button. They are truly automated, and so they actually will just say, analyzing rhythm, stand clear, and shock advised, shock delivered. So if it has an on button and it says push button, then follow the prompts. It is very fail-safe in that it will tell you whether you have to push a button or not. But it's good to, if you are in school and thinking about that you may need to use this, then to be familiar with your own AED and know whether it's a push the button or whether it's an automatic device. So if there aren't any other questions, then I just wanted to make sure that Rich can show you exactly how to make this. And there is a whole sheet that you can send to your students electronically that will kind of show them how to make this mannequin. But since for a while we all know we're not going to be in person, then it's really kind of a nifty thing that they can do and feels very much like a real mannequin. So I'll let, if there aren't any other questions, then I'll let Rich take over and maybe just go through a little bit more detail of how to make this mannequin.
Yeah, absolutely. Thank you, Dr. Vetter. Before I begin, are there any questions before we go on at this point? Okay, fantastic. So to make this mannequin, you do need a couple things. They will need a t-shirt. So you see I have my shirt here. You will need a simple soda bottle, now a 2-liter bottle. It's important that it's big so that it works as the CPR compression. And they need a cap. So the cap must be on, because if there's no cap, then there's no way for the bottle to re-inflate at that point. You'll also need some kind of a filler to pad around the bottle. I chose to just use some grocery store bags. I'm sure everybody has them. And then the last thing they're going to need is a rubber bands, or I used my daughter's hair ties. So that'll work too. You'll need 3 hair ties. So we're going to take our shirt. Let's see if I can bring that screen down. You're going to take your shirt. You're going to lay it on the table just like that. So as far as this filler, again, I'm using plastic bags, but newspaper will work fine. Anything that's kind of fluffy. So we're going to take that. I'm going to make another one. So we'll take that fluffer or filler again. So I have 2 of these. You're going to insert your 2-liter soda bottle directly into the center of the chest on this shirt. Just like that. You'll take that filler, and we're just going to put this to the left and to the right of the soda bottle, which basically keeps the 2-liter bottle in the center of the shirt. This right here, right? So let me see if I can, without moving the camera too much, you can see that I have my soda bottle in the center of the shirt, surrounded by padding on either side. And then lastly, we'll take these ties here, right? You're going to put one on each of the arms of the shirt. So that covers up the holes in the arms so that none of the filler is able to come out. And then lastly, you're going to take that 3rd one down at the bottom of the shirt and kind of just close that up and keep that all in. All right, so we'll wrap that. And then I'll hold this up so that we can see the mannequin. You know, it looks like and acts as the chest of a CPR mannequin. So I show you, I have this one right here, right, versus our CPR mannequin, and they really do work the same. So I will just kind of show you a couple compressions on here. Again, like Dr. Vetter said, hand in the center of the chest, and we're just compressing. So again, it's important to have the cap on it, because if they don't have the cap and I compress, you notice that my bottle goes all the way to the table and doesn't reinflate. So that cap is a super important part there, and it really does act as a CPR mannequin. I can also talk about, Dr. Vetter, if you don't mind. I have the AED I made again real quick. Just simple. These are printout AEDs. I stole the shoelaces out of one of my child's shoes and attached the AED pads to my AED. So shoelaces, string, anything like that will work to give you the ability to act as that AED.
Great, thank you, Rich. Has that brought up any questions, or does anybody have anything, either questions about teaching this, suggestions for what else you might want to do? You can, stream the video to yourself and look through it and decide, what other parts of it you either do or don't want to use. And you can, as you're streaming it, you can move it along quickly if there's a part that you don't want to do. The video also has rescue breaths, which we don't generally recommend in kids who are older than puberty, but under, it is recommended that we do rescue breaths, so that it will have information on how to do that. It's 30 to 2, and you want to look for a rise in the chest, particularly for young children who may have had a cardiac arrest because they've had an asthma attack or something like that. They actually do need breaths, or if they have had a drowning, then they need to have breaths because they don't have much oxygen in their blood. The reason that Hands-Only CPR works is because we all have about 5 to 10 minutes worth of oxygen hooked up to our red blood cells. And so we can push that around to the body and have the cells extract that oxygen. And that's why we don't have to give rescue breaths in a normal situation. But if somebody's had an asthma attack, they're a young child, they're more likely to have had a cardiac arrest because of some preceding respiratory problem, and particularly if they've drowned, then that's the case, so that they will need rescue breaths. But that's all covered in the what we call the optional module, which has the rescue breaths in both adults and children, and has choking in adults and children, and that's available from the district office as well. Okay, so was this helpful in any way to you guys?
So Al just asked how they access the materials, videos, and lessons. So the school district, I'm not sure exactly who, maybe Amani or somebody can speak to that, will share those with you directly. I'm gonna send the link to well, maybe I don't have the link. But all the information will be on the lesson plan with the link to the videos and the passcode to get on there. Dr. Vedder, do you know who will be sending those along?
I would think that it would probably be Nancy or Nancy's office or Judith's office.
Okay.
Like Dr. Vedder said, there's a lot of handouts that go along with that. There's an AED sheet that, helpful hints. There's a CPR sheet. And we really put a good packet together for you guys to be able to teach this lesson.
I'm going to type this in as well. So the first part is the where you access it, and this is the access code. The second part is the access code. If you go to that ebooks.heart.org, can everyone see that in the chat space along the side there? That's the URL or the website, and then CPR in schools, all in caps run together, is the access code. So if you save that, it will have all of those modules on it that we said, but it's also on the lesson plan, which actually does, I think, look like a real lesson plan, because Nancy and Judith took what we sent to them and adjusted it to what I think you as educators are used to seeing. It also, all the schools have this DVD here, but I think it's actually easier, and the students are used to streaming everything, so I think that under your direction they'll be able to use that. And it's really an excellent video that the American Heart Association has put together. So I think that it's much better than the old videos that they used to have, and it's very, I think, aligned with anyone from middle school to through high school. Any other questions? Amani?
Well, if no one has any more questions, please don't forget to click on that link so that you are checked off for attendance. Did it work? Did anybody click the link so that I know that it's working and it's okay? Okay, perfect. Well, thank you so much for joining us today. Again, my name is Amani Fields, and I work out of the Department of Athletics, and I'm actually the manager of all the AEDs in our school. So if you have a specific question about an AED, or if you feel like your school doesn't have one or you need a new one, please reach out to me. Here is my email. I know we're not in the schools now, but if you want more information, here's my email. I'll put it in the chat box. Okay, if that's it, you guys are free to go.
Bye.
Bye, everyone. Thank you.
Thank you.
Thanks a lot. Take care.
Absolutely.